Hi, this is Yazabul live from SCAI 2019. I'm pleased to be joined by Dr. Blankenship and Dr. Duffy. Doctors, thank you so much for joining us. And today we're going to talk about the document for cath lab economics. This is a new publication that has just been released. Dr. Blankenship, tell us a little bit more about that document. What was the unmet need here? Why did we even need this document?
Well, as the subtitle of the document says, we felt that those who work in the cath lab should understand its finances, since the finances of it affect at some level everything that happens in the cardiac cath lab. As we see healthcare evolving with new payment mechanisms coming on board, the incentives are going to change, and the way that cath lab operate are going to have to change as well. For instance, there's going to be a large shift from the inpatient to the outpatient sector. Also, we felt that particularly physician cath lab directors need to be able to talk with their administrative partners about the financial aspects of this and be able to advocate for patient care, which is sometimes more expensive, and make sure that they keep the cath lab solvent financially, but also take care of patients and make sure that their needs are accounted for.
Yeah, Dr. Duffy, what do you think some of the key points are from the document, the key takeaways?
So one of the major things really is an understanding of the new payment models there, what the current payment model is and what's emerging. And I think that's critically important for us for multiple reasons. First is interventional cardiologists, even though they may be employed by the hospital, really don't many times recognize that the payment is not coming from the hospital. The hospital is a pass-through. They're really getting paid by CMS for the most part and by the third-party payers in many cases there. So to understand how they're changing their structure for payment to the hospitals is going to be critically important to physicians going forward to understand how they're going to get paid. So one of the primary purposes of the document was education first as to what the current payment model is, what the emergent payment model is, and how physicians can work with their administrators to better prepare their systems to be able to meet the needs of those new payment models so they can continue to get the reimbursement that they deserve.
Yeah. Tell us a little bit more. I know there was a collaboration with the Alliance for Cardiovascular Professionals. Tell us a little bit more about that collaboration. Why was that important?
That's critically important because really this is a team sport, and this is not just done by physicians. It's going to be done by cath lab managers and by other professionals that work in and around the cath lab that have management skills that we as physicians don't have, or if we have some management skills, don't have time to implement fully there. So recognizing that we're not insulated, it's not a physician issue, it's a cath lab team issue was important, and we thought it was important to bring those professionals in with it as well into the document.
Dr. Blankenship, cath lab managers who are listening right now, and you want to give them one piece of information that they can implement right now to basically improve cath lab economics, what would that advice be right now?
One of the first things that a cath lab physician manager can do is to make sure that they have assembled the team of people they need to be able to execute the ideas of the cath lab economics. That includes supply chain experts that will help negotiate with vendors. That includes financial experts that can help justify and build financial models that allow us to introduce new technologies such as the MitraClip and left atrial appendage occlusion. Also includes coders, and we found that if you don't code correctly, then you're leaving a lot of money on the table. So let's get credit for what we do and make sure that we code accurately. So we have to get the coding, clinical documentation improvement specialists on board. And then, of course, most importantly, the operations managers that run the cath lab day to day, as well as representatives of the teams, cath lab techs and nurses. We have to have all these people working together as a team to accomplish what we've outlined in this paper.
Yeah, Dr. Blankenship, Dr. Duffy, congratulations on the document, and thank you so much for joining us.
Thank you.
And thank you all for joining live from SCAI 2019.